Welcome to the Bennington Area VNA and Hospice News and Information Show. I'm your host, Marc Miele, Marketing and Fundraising Coordinator for the Bennington Area VNA and Hospice, also known as BAVNAH. In October 2014, BAVNAH was purchased by the Rutland Area VNA and Hospice. Although we are no longer part of SVMC, we still work collaboratively with the hospital to ensure the highest quality patient care throughout Bennington County. BAVNAH is a Medicare-certified home health and hospice agency. And what that means is we are certified by Medicare to provide services to individuals in their own home, wherever they call home. We are a nonprofit VNA and hospice serving Bennington County. And what that means is we are governed by a volunteer board of directors, and all money goes directly back into the services offered to the community. Our services include nursing, therapy, social work, hospice, and community clinics, all of which help keep individuals safe and comfortable in their own homes. This is a series of shows that will inform you of news and information, upcoming clinics, and events provided by BAVNAH. Today with us is our Choices for Care and Care Plus manager, Marley Mason, who will be discussing the Care Plus program offered by BAVNAH. Welcome, Marley.
Thank you, Marc.
So, Marley, could you tell us a little bit about the Care Plus program?
The Care Plus program is a private duty program designed to keep individuals at home, or what they call home, wherever they call home. It can be in a nursing home, it can be in a residential care home, but it is designed to keep people safe in the environment in which they choose to live.
Mm-hmm. Just kind of an extra support for individuals in their home to try and, help either maybe monitor them or help prolong their stay and make their recuperation time maybe.
Absolutely.
A little bit.
Absolutely. We have some clients that if they're being discharged from a nursing home, for example, the family likes extra support in there, temporarily perhaps, for a few weeks, a month, whatever the case may be, just to make sure that their loved one is safe and home. We have clients that were there 2 hours a week. We also have families that have hired us to provide 24-hour care, 7 days a week. We have one client, we've been in the home for 2 years now. It's completely dependent upon what the family feels they need, what the client feels they need.
So it's tailored to fit.
It is absolutely tailored. And the services that they receive are tailored to meet the needs.
Right. I have, a member of my family who has a similar program, and it's my mom, and, I can't be there all the time.
Right.
And she isn't really looking for someone to be there 24/7, but she needs a little bit of help, scrubbing the bathtub, doing some minor grocery shopping for her, just little things to help her out around the house. Plus, it's somebody that we know is in there a couple of days a week just to help out for a couple of hours, and we know that somebody's been in there just to, check on her during the times when we're not able to.
Right, right. It's interesting because very often it's family members calling us. Particularly after they've come to Vermont and they have visited their mom or dad. They may call us and say, I was up last weekend and I'm a little concerned that my mother isn't eating properly. Or she tends to be a fall risk and she's doing chores that we're not comfortable with her doing. That's one of the biggest referrals we get. And it's really peace of mind for a family member. We also get a lot of calls from a spouse that is saying, I just physically am not able to meet the needs of my spouse, and I need help with a variety of different tasks. But I want to be clear that this program does more than run errands, do homemaking, which they do. We do laundry, bedding, vacuuming, dusting. We do all of those things, but we also can be pretty high tech. The needs of the client, we initially assess, and it may just be the companionship, or someone needs respite, or it may be that we have an individual that is unable to get out of bed in the morning, that needs someone there to actually transition them, transfer them from their bed to their chair. They may need bathing, toileting, all aspects of personal care. We do quite a bit. We really do. It's a wide, vast program with a lot of services offered. And one of the nice things through the visiting nurse is that not only do we send this aid in, it can be a PCA or an LNA, But we also have the support and the backing of PT, OT, nurses. If we have a concern, families can hire us to do blood draws at home, to provide physical therapy or occupational therapy.
Right.
There's such a variety, and every case is tailored to what the individual is asking or needs.
Well, that leads me to a good question. Who is eligible for the program? Is it open to the public? Is it, somebody, do they have to get a referral from a doctor? Is it just somebody calling up and saying, I know you said it's a private duty care program, so how does that get started?
Our referrals come from everywhere you just mentioned. Okay. They can come from a doctor, but they certainly don't need to be a doctor referral. It is, because it's private, it's open to the community. It's anyone can access it. We don't have discriminatory clients, and I mean, certainly there may be some very challenging cases, complex medical cases that we're dealing with that may take more time initiating. But anyone really can access this program, and I go out and do the initial assessment. I meet with families, I meet with the potential client, and we determine what the needs are. And if it isn't something that we can manage, then we certainly say so. But 99% of the time, we're able to meet their needs.
So you are actually the person that would go out and assess the situation, talk to the client, find out what they're looking for?
Most of the time.
Most of the time? Okay.
I'd say 9 out of 10 times it will be me that does that. But from time to time, I go on vacation. And if I'm away for a week or two, we are certainly not going to make a family wait for my return. So there are a few other people in the agency that are certainly capable and able to do this in my absence. So that's the answer to that, Mr. Mark.
Well, with that being said, who are the typical people? And there probably isn't a typical client that calls up, but are there any specific age ranges? You were talking about sometimes spouses need, extra support, helping out, their wife or their husband. Are there age limits? You had mentioned something about, helping people to transition from their bed to the chair to...
No, not really.
No.
Our clients tend to be adults. They don't necessarily have to be. We have a young client that we're trying to initiate services with currently, but that's not the norm. Typically, they are older adults, and it's so different. Every case is so different, but primarily it's older adults. Many with dementia, many with mobility issues, a wide variety of needs we try to meet.
Is there a specific, I don't want to use the term turnaround time, but is there a specific time frame that people should expect, from the time that they call you up and say, yes, I would like to have you come out to my house, That's
a really great question, because we pride ourselves on returning calls within 24 hours.
24 hours, okay.
Whether we're in the office or not. Within 24 hours, we return the call. Very often, I go out the day that they call me, but certainly that's dependent upon the family's availability. Often I'm dealing with people from out of town that are calling about a loved one, so we coordinate what works for them, when they're going to be in town, and I get there as quickly as I possibly can. Another part of that is, as far as initiating services, if someone's calling and needs minimal coverage, a couple hours a day, a couple days a week, that's pretty easy to pull together very, very quickly. The more complex the case, the more lead time we may need. I'm hesitating here intentionally, and I'll tell you why. Because there are some cases where they've called us, say, Monday, and by Tuesday, they have services in place. Extensive services, particularly if we're getting a call from a nursing home. We work very close with the nursing home discharge planners, and they may call me and say, I have someone that's being discharged Wednesday, they need round-the-clock care, and I don't jump with glee. However, I mean, because that can be really challenging.
Right.
But there have been times we've been able to meet that need immediately. Other times, I will say to families, we may need a couple of days to get this schedule together, and we do. We've been very successful.
Yeah.
Rutland, we started this program in Rutland many years ago, and it's grown. It's really grown rapidly. I think part of the reason is we're well respected in the community for what we do. We take a lot of pride in our work,
Sure.
you know, and we've helped many families, and so it's grown.
Yeah.
Our reputation speaks for us now.
Right.
We're trying to establish this into Bennington. There is a need here. It's something that we've been working very hard on since the merger last fall, and we are ready to start moving in that direction to be able to provide that same care to the residents of Bennington that we've been able to provide in Rutland. We're really excited about it.
Well, and that brings me to, you know, another question. Who are the people that actually go into the homes to provide services? Again, knowing that they're tailored for the specific needs of the client, who are the people that go in there? You might have said it in the beginning, but I forgot.
That's okay. That's okay. It really depends on what they need.
Okay.
Our staff consists of PCAs, which are personal care assistants.
Okay.
We have people that are companions, people that are LNAs, and then RNs, physical therapists, occupational therapists. It all depends on what a family needs. The typical request is for a PCA or an LNA.
Okay.
Okay. So those are the individuals that would go in the home.
Okay.
And very often we have clients, who need someone just to stay with them. Particularly if you're speaking about a client with dementia. They just need someone around to make sure that they are safe in their home.
Sure.
So we may be their companion. And then we have others that may be high tech, where we need a nurse in there with them because of the complexity of their medical needs. So it varies again.
Right.
I don't mean to be evasive, but it just varies depending upon what the needs are.
Obviously, because there's so many different.
We may put in some skilled nursing in some of the skilled individuals from our agency initially, and then we can kind of wean back as people progress. And I'm referring to people that are coming out of a nursing home.
Sure.
But we staff it appropriately based on the needs. I guess that is really the best answer that I can give you.
And knowing this firsthand from my own personal experience, I know the personal care attendant that comes into my mom's house had a background check, screening, all of that done. So it's the same regardless.
Oh, absolutely. Not only that. I typically, myself and the woman I work closely with in Rutland, Joyce Humphrey, Joyce or myself are the two that do the interviewing initially. If we choose to employ someone, they then go through a health screening. They attend 2.5 days of orientation. Most of it, the majority of it, is agency directed and personnel policies, et cetera. And there's a large section that just focuses on what is right and what is correct when you are going into an individual's home.
Right.
They also have the background checks that you mentioned, which our agency does every other year. So if someone comes in and they have this perfect background and something happens in the first year, we are going to, in fact, find that at some point. And they're bonded and insured, which is huge, because if you hire someone independently on your own, you don't have that.
Right.
And this is a very well-oiled machine that we have going. We are constantly looking at it and finding ways that we can improve the care based upon what clients are asking us and telling us. So we're in a good spot with this.
Perfect.
I love it.
Well, I mean, it's got to be fun too, just to, you know, meet some of the clients that are out there, you know, talk to the people in the community, kind of make that matching, if you will, with, you know, the nurse or the PCA or whomever it might be, and, you know, just knowing that that client is happy and comfortable and able to remain at home or wherever they happen to call home. You know, that's a big thing for them.
We have followed people from their home that have been in their home for maybe a year, whatever the case may be, and they are in need of going to a more secure environment. And families have hired us to continue providing care so that their loved one has consistency, has folks that they recognize. So we can continue with them. And another piece I didn't mention is we work very closely with hospice.
Okay.
And when you mentioned it must be fun and enjoyable, it is. But I think I would define it more as an honor. We are, in many cases, particularly when we're dealing with hospice, we're dealing with individuals at the end of their lives. And my personal view is what an honor it is to be part of that and to provide care for this individual and to be supportive of the family in any fashion in which we can be supportive. Yeah, I love our clients.
Yeah.
I really do. It can be difficult at times, but I think the joy that we receive by providing this care exceeds most positions.
Well, and I think that's, a nice point to bring up is the fact that it's just the Care Plus program is one facet of everything that BAVNAH has to offer, because you can be doing home care, you can be in the hospice program, all still while getting services by Care Plus. And you've got this whole support system going from the VNA and hospice, and you still work closely with their doctors if need be.
We do.
So it's nice to have that whole support system and to assure the families that we can help. We're here to help. We've been doing this for a while. We know a lot of the trials and tribulations involved with recuperation or whatever might be going on in their world. We have the experience. We understand. We're compassionate. We'll do everything we can to possibly help and stay within that support system.
I think respect is the biggest piece of this for me. I mean, individuals that are contacting us are often in a crisis situation. Often they are not. They're planning, but as I said, it's an honor, and we must be very respectful on how we treat our clients.
Right.
And another thing that we have done, and we do frequently, is we provide, people don't have to stay with us forever. People can call us, and as I said, I mentioned the nursing home, coming home from a nursing home, and they may want us temporarily. We have families that have called whose loved ones are visiting from out of state. This has happened a couple times in the last month, where someone calls and says, my dad is going to be up here visiting. My mom has this particular condition and cannot be left alone. We'd like to hire you for this weekend. And we can do that. So it can be intermittent. It can be, we have a family that goes on vacation every year, and when they go, we come in and we stay with mom. It can be 24 hours a day. Again, another instance of how it is tailored to meet someone's needs. So they don't even have to be a resident of Vermont to receive this care.
Okay.
Which is a big deal. We can just move right in if that's what they need us to do.
Sure.
And we do it.
It's always good to know, too.
It is.
I keep on hearing you say hire. To hire us. Who, and it's private duty. You've said that.
Correct.
So explain a little bit as to how it's actually paid for.
Okay. Primarily two ways. People will pay us out of pocket for our services.
Okay.
Based on an hourly rate. There are differentials in rates based on weekend, holiday, that type of thing, but it is private pay.
Okay.
There are some individuals that have a long-term care life insurance policy, long-term care policy, and often that will cover it as well.
Okay.
Typically, if they have a long-term care insurance policy, there is a daily cap, and there may be a few elimination days. Some people also may, if they're waiting to get perhaps on the Choices for Care program, which is you have to meet an income eligibility guideline to get on Choices for Care, and sometimes people are over-resourced, and they may hire us privately to spend down their dollars until they become eligible for the other program.
Okay.
Did that answer your question?
Yes.
Okay.
Yeah.
Okay. Just want to be sure that I'm clear.
No, it does, because there's a lot of, I know that there's a lot of gray area that could be involved in that. And you take care of figuring out all of that information, which takes the burden off from the families as to try and figure out, how do I do this? And it's nice to be able to have somebody who's got the experience to, to jump in and say, I can take care of this for you,
And that's what often people really need, particularly at that time.
And I just had another question for you, but
what?
It slipped my mind. So it'll come back to me in another couple of minutes here. I know at one point, before the camera started rolling, you had mentioned something about you are looking for...
Yes.
Who are you looking for down here? I don't want to speak for you.
No, that's okay. That's okay. We are in the process of trying to build a team. In Rutland, we have a team of over 100 individuals that provide care only through the Care Plus and our Choices for Care program, which is a separate entity, but aides, LNAs, PCAs that provide care to all of our private duty people. Okay? It's a large pool of individuals. In Bennington, we are trying to build that pool.
Sure.
So we are currently in the process of recruiting, interviewing, and hiring appropriate individuals that would like this type of work.
Okay.
And so I'm looking for probably 10 to 20 individuals that are either PCAs or LNAs that are looking for a really wonderful career.
Yeah, definitely. Very rewarding.
It's very, very rewarding.
Is there a number that they should contact for that?
They can call me.
They can call you.
They can call me directly.
Or visit a website.
Well, they can go to our website under jobs or employment, excuse me. But they can also call me, or they can call the office in Rutland, and we will send them an application and schedule an interview for them. Right.
Or they can visit BAVNAH.org and go through that channel.
Absolutely. They actually can just stop in at the office in Bennington and pick up an application if they'd like. If they'd like.
Which is 1128 Monument Avenue. So,
correct. Correct.
Well, that's great. So, well, I know that we've talked a little bit about some of the services that are provided, but there's a whole gamut of what's available out there. What are some of the? I know you said support for hospice, and I know you talked about home care, but you do other things. Personal companion. Well, that would be the.
Well, I can tell you in a nutshell what we do.
Okay.
We provide personal care, which can be minimal or extensive. Assistance with shower or showering.
Okay.
I mean, some people need the supervision to make sure that someone is there while they shower, or we can physically do the shower, whether they are in a shower or, I mean, we provide bed baths. We can do the homemaking piece. As I mentioned, the vacuum, the dusting. We can run errands. In some cases, we transport people to and from medical appointments.
Okay.
That's an on-need basis. It's not something we always do, but we certainly try to put that into a package if that's something that someone truly needs. Right. Okay. My goodness, there's so many different things that we can do with people. As I said, we can do blood draws. We can do foot care.
I was just going to ask that.
Yes,
we have people.
We do have people. It would be a different person from the LNA or the PCA. We would have another staff member from BAVNAH, a nurse that would go out and provide that care, but they can contract that through the private duty program. Okay.
Okay. So if somebody did need something a little bit more specific, let's just say that you've got a PCA that's in the home, and they find that this individual is starting to get to a point they're going to need some more services of some kind. What do they do?
Typically, they will call me, or the office, someone else they may call, and we will reassess and make sure that we're sending the appropriate player into the home.
And all, I'm assuming, while staying in contact with
Oh,
the
absolutely.
doctor, so that way everybody's on the same loop and, you know, contacting the families and just saying, you know, hey, by the way.
Absolutely. And one of the nice things, we also, it can be challenging, but we strive for this, consistency in staff in the home. Okay? So, for example, if we have Wendy that goes into Mrs. Smith's house every day or 3 or 4 times a week, whatever the case may be, for a month, she's going to be familiar enough with this client to know if there's something different. You know, for example, she's been quite mobile, but suddenly she notices that she's doing this to get up, or she's limping, or something's happened. Our staff will call us, and we can put in a PT referral. We will address it in any way that we feel is appropriate at that time. The other thing I didn't mention is that we also provide meals. We prepare meals.
Prepare
we don't
meals.
provide them.
Yep.
We do that as well. And our aides in the home, we have a logbook, and they will write down what they've eaten, what they've done, so that the next person coming in has an idea of what's happened. Or when the family comes.
Right.
They also know, oh, great, Mom drank this much fluid today.
Right.
She ate this today. So, I mean, there's communication tools that we use between the staff in the field, the office, and the family. Whenever we hire a new person, we tell them, you're not alone out there.
Right.
You have BAVNAH, you have RAVNAH behind you. And that's a beautiful thing.
That's great. So, I guess we're going to wrap things up here. And I thank you very much for, you know, spending some time with me today. And,
Sure.
you know,
Not a problem, Mark.
letting the individuals here in Bennington know about another one of the programs that is offered through the community. And that's one of the things that we're trying to get out there, is to let people know that, hey, we're here in the community. We're one big support system. We're all one family at BAVNAH, RAVNAH, DAVNAH, the whole organization. And we do take, you know, very good care of our patients. Very respectful. We've been doing this for a long time, and we're, like you say, honored to be able to be a part of whatever we can do to help the individuals out.
I'm very happy to be in the Bennington area.
It's phenomenal. It's a great community.
Really happy to be down here. I've met wonderful people. I love the agency. So I'm glad that we're starting this down here.
Me too. Me too.
I really am.
So I'd like to say, for more information, you can visit us at our website, www.bavnah.org. You can call our office at 802-422-5502. And don't forget to like us on Facebook. We do have a Facebook page for BAVNAH down here, so we'd like to get that out there. There's always news being posted up on there as well. So thank you again, Marley.
You're welcome.
Thank you, everybody, for watching.